Welcome back. I'm Mabel, Jong. You're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. Thanks so much for joining us. And we're going to continue our coverage of the panels today with our conversation with our guest in the studio, John Bulger, Chief Medical Officer at Geisinger Health Plan. Thank you so much for being here.
Thank you for having me. It's great to be here.
So you're participating in a couple of panels today,
Yes.
Is that right?
Yes.
Give me a recap.
I did one earlier this afternoon, which was on the use of technology and how leveraging different data points to improve patient-centered care. And then there's a keynote this afternoon that I'm doing that's looking at how we can change the experience for patients and members and make it better across the board, and what different people are doing different things to try to do that.
Yeah, so in terms of patient engagement, is it all about the technology, or it really depends on the community of
I think it
patients?
depends. I think it's a little bit of technology and a little bit of how we taken care of patients all along. And actually, interesting, I think a lot of the things we've been successful with, it's where we marry technology with things that physicians and other healthcare providers have been doing for a long time, and you figure out what needs to be high touch and what needs to be low tech, what needs to be high tech, what needs to be high touch, what needs to be low touch. So it's really marrying the two together. Mm-hmm. I think where we've gotten into trouble, and I think other people get into trouble, is where you just rely on the technology,
right.
And you realize that the technology, it's a tool, but in and of itself doesn't necessarily change anything.
What works for Geisinger?
I think what we found, one good example, we've been doing a program called Geisinger at Home, which is essentially doing home visits, doing house calls with doctors and advanced practitioners and nurses. Now, we've used a lot of technology to back that up. First, we find the patients who would be best to use those house calls using all the data we have, be it claims data or clinical data. We also back it up by using things that you can do things in a home now that would have been more difficult to do years ago, IVs, and we do telemedicine. The nurses can sit with the patient in their home and talk to an emergency room physician, for example, and not have to actually go to the emergency room and stay in the home. But it's really good old-fashioned house call, which is the key to what's going on. So it's a good example of that, marrying something we've done for 8 years and years, and marrying it with the technology that makes it different.
Okay, and how have your members actually expressed what works for them, or you just noticed that there wasn't any engagement happening?
One of the things we've done is we've trying to get more and more member input into what's going on, whether that's having members, as you said, express what their preferences are up front, so we know who would engage this, but also asking members, hey, what do you want? What's your goal for your healthcare? What do you want? And then after you've come up with a plan, actually asking them, how's it going? Yeah. And it is one of these things in healthcare, a lot of times it's the clinicians, we're doing things and we're not actually sitting back and listening and asking the patients, one, what they want, and two, is what we're doing consistent with what you want? Do you think it's going well? Because I might think it's going well as a doctor, because the patient's getting better, but the patient may be suffering from what we're doing to them. So actually getting that engagement is very important.
Okay. You participated in 2 different opportunities here at the Congress. What was the second one?
The second one is around how do you improve the member-patient experience, mm-hmm. and what are new things you're doing within your healthcare system, mm-hmm. to improve that. So, and one of the things I'm going to focus on is a lot of the work we've been doing is an integrated delivery system to get the provider of care, the physicians, nurses, hospitals, et cetera, working with the payer of care and the health plan side. And how do you offer, almost a concierge experience for the patient. So a lot of times we put the patients in the middle between those entities, between the doctors and nurses and hospitals and payers, the health plans, and the patients are kind of pinged around.
Yeah. So is that good?
It's not good. And
okay.
I think when you talk to patients, they feel that, because they feel like they're put in the middle, and it's like, gee, how do I decide? And a lot of times they trust all those things. They trust their hospital, they trust their physician, they trust many times their health plan, but when they hear different things and those groups aren't working together, it's very confusing for them, and then they end all is they just don't trust the healthcare system at all.
At all. So what's the best approach then? What happens when the relationship gets to that point?
Sure, I think it's a lot about communication. It's really how do you get all those people, and again, that's one of those things that's high tech, low tech. Some of it's just getting everybody sitting in the same room so that you can have a discussion about what's the right thing to do for the patient. Sometimes it's high tech, sometimes you're doing that by teleconference, or you're getting on the phone and doing it. But it's really just as simple as getting everybody together at the same time and asking the questions. And the crux of the question is what's the best thing for the patient and how can we all work together to get that done.
Do patients still like to hear from the physicians themselves?
I think they do. But they're also very eager to hear from other members of the healthcare team. A lot of times, though, I think they want to know they want to hear their physician say, "Oh, well, this is Jim, the pharmacist that I work with," or this is even with specialists. If it's a primary care physician referring to a cardiologist, they want to have me say, "Well, I'm real good friends with Dr. Smith, who's the cardiologist that I'm going to send you to, and she's a great doctor, and she's going to take really good care of you."
Yeah.
And that confidence, when the patients hear it from their physician, I think goes a long way.
Yeah, definitely. That reassurance from the main person,
Yep.
the main person of the team. We've gotten a chance to talk a couple of times over the years. What have you noticed has improved during your time at Geisinger and in the healthcare space in general?
Sure. I think patient-centeredness has definitely improved. I mean, I've been at Geisinger 21 years, and I think as a primary care physician, kind of by training, I've always had that kind of feel, but I think the ability that I feel to be able to provide patient-centered care has changed over time. I think healthcare is much more of a team sport now than it was 20 years ago as well. And this notion that there are other members of the team, whether they be other physicians you're working with, or they're nurses and as I said, pharmacists and social workers and other members who are able to provide that care for the patient. And I think the difference is as a physician is getting to understand, how do you work with that healthcare team? Sometimes I'm the leader of the healthcare team, sometimes I'm just a member of the healthcare team, and being able to work with multiple people to actually provide the care for the patient. Because it's just as healthcare gets more and more complicated, one person can't do it. Right. And you need that team. But there's much more of a willingness, I think, for people to work together. And I think even in training, people are trained more to understand that it takes a team to do things.
All right. Dr. Bulger, thank you so much for your comments
today.
I really
appreciate
you sharing. And I'm Mabel, Jong. Stay tuned. We have more content on the way.